Hello, I'm back. Oh my god. Also, if I've never introduced myself in any of these vlogs, oh my god, my name is Michael Saigan, but you can call me Mike. And I'm here to talk about mental health care. Okay. Wow. So, no project update right now other than I'm working on a album that I'm really excited about because, so I guess this is a little bit of an update. I've been taking video over the course of this spring into summer, winter, spring, and summer, of like some local areas, some local trees, just some spots where it's very observable to notice the transition from winter to spring to summer. And if you're familiar with my previous work of these albums or music videos or whatever, it's gonna be pretty similar, but the visuals are gonna be of the transition between seasons, which I think is pretty great and beautiful. And the stuff that I've made so far, I think is pretty great and beautiful. I'm very excited to put it all together into a final piece of work. And the really cool thing about that is the seasons just like don't stop changing. So I can continue to update this as like, time passes, which is really cool, which is actually, it actually folds into the metaphor of the album itself. So it's all very, it's all very exciting. Oh my god. It's kind of hazy out today because there's wildfires in Canada, and the smoke has blown down here. It's not very exciting. It's very horrible. It's a very horrible situation, but gotta keep going on. Gotta keep keeping on because what else are we gonna do? So something that I've been thinking about like for a very long time, but this kind of paradox has been like just like circling around in my mind for a very long time, and it just like keeps on like, I feel like I've probably even talked about it in any of these vlogs before, but there's like a paradox that I've been thinking about that is just so annoying, and it's actually such a great argument for healthcare for all that I just need to dig in and just dive in and just keep on talking about this paradox because, oh my god, it's just such a paradox. And it can be resolved, but not without any kind of communication of the paradox and effort to resolve the paradox. So here's the paradox. I even printed off some stuff, but I'm gonna try and do it off dome because I love doing that. Okay. So the paradox is basically how it's just like super annoying that in America, how the healthcare system is currently organized. If you're a disabled person and you live with a disability, if you're born with a disability or you find yourself disabled, there's so much assumption on behalf of the healthcare system kind of like placed onto the disabled person. The assumption being, oh, you can figure it out. You have the capacity to figure out how to either file disability claims for disability insurance from the government, or you have the wherewithal to go get your job that has healthcare benefits, which is famously becoming less and less of an option for the American workforce. So there's an assumption that if you're disabled, you're going to be able to either file for disability, which has a lot of paperwork in of itself. You have to go to doctors. You have to pay out of pocket for those doctors because you don't have the insurance yet. You have to get the doctors to certify that you're disabled. Then you need to file that paperwork, and then you need to like prove that you can't make income, and then you need to just like file all this paperwork. That's a lot of work for someone who is disabled, especially if the disability is like a serious mental illness like schizophrenia. I think schizophrenia is like one of the best mental illnesses to talk about in this context because truly, if you have schizophrenia and it's untreated, it's going to be likely impossible to, one, file for disability because there's just a lot of paperwork and there's a lot of tasks that you have to complete. Or it's going to be impossible to get that job that gives you benefits so that you can get treated. So that's a paradox. The harmful thing about that is if we have a population of untreated people living with disabilities, that just like is this horrible situation where people can become homeless. They can just like be imprisoned basically for their mental illness, like all these things. Like it truly, the onset effects of not giving people with disabilities healthcare, just like it's just horrible. It's just like, if you just like truly think about it, it's just such a paradox. It's so horrible, it's inhumane, and it's just horrible. This, of course, doesn't mean that everyone should have healthcare. I believe that everyone should have access to healthcare. I think that healthcare should be made available for all. In America, that's just a very controversial thing to say, but I think that it's almost irrefutable that if everyone in America had healthcare, things would just be better in America, and that could really reverberate through the system. And it could really make things a lot better for the country as a whole. So now let's get into my notes. Okay, what do we got here? So prevalence of serious mental illness. Approximately 1 in 20 US adults experiences serious mental illness annually, including conditions like bipolar and schizophrenia. So 1 in 20 US adults experience serious mental illness. That means that 1 in 20 US adults are kind of not in an ideal situation to either file for disability or to get a job that will give them benefits like healthcare. That's a lot of people. Despite the severity, only about 65% of adults with serious mental illness received treatment in 2021. So that is 35% of people with serious mental illness not receiving any healthcare at all. That doesn't even include the people who are not receiving adequate treatment or following the treatment plan or anything like that. It's just 35% of people with serious mental illness are not receiving treatment. That is horrible. That is disgusting. It's inhumane. That should not be how our country operates at all. It's just truly incredible. It's shocking. Employment and insurance. The United States healthcare system often ties insurance coverage to employment. However, serious mental illness can impair one's ability to maintain employment, creating a paradox where those most in need of care are least able to access it. Again, just another way of saying it, it's just this horrible paradox situation that really, it's not designed for making the population like functional or happy or anything. It's just the system of cost cutting and horrible stuff. I'll save my editorialization. I've actually published a few articles about it. I can add them in here. But it's just truly incredible how this is how the system is designed, and we're just supposed to be like, oh, yep, this is good. I think this is great. I think that we should continue operating this way because 35% of people with serious mental illness, who cares? Like, that's fine. No, it's not. All right. So what else we got? Yeah, the complex application process. Applying for disability benefits is a complex and time-consuming process, often requiring serious, extensive documentation and legal assistance. The other thing about this is the role that caregivers have in this. It is assumed that basically anyone with disability in the United States has a caregiver. That's just something that's assumed, and that's not the case. If anyone watching this has a complicated relationship with their family, then it may be complicated for you to lean on someone and ask for help when it is assumed that that person in your family is gonna snap into gear and be able to help you. That's a big assumption, because the people who have the least ability to like take time off work, really focus on getting the benefits and all that kind of stuff, they're going to be the same people who don't have healthcare, because like the jobs that don't offer healthcare benefits, which is becoming a lot more percentage of the jobs that are available in the United States, those are the jobs that overwork you, underpay you, and make it so that life is just hard. So the thing about that is, if you're in one of these jobs and you find yourself maybe having a child that has a disability, then it's on you to make sure that your child gets like disability healthcare. But meanwhile, you're being overworked and underpaid. So it's like, that's a complete paradox, and it's a completely unworkable situation. And that burden should not be placed on anyone. No one should be asked to do that. When we literally have a country that like the government could be like thinking about these things. It shouldn't be like exported onto like the civilians of a population to be like, oh no, you figure it out because like we don't want to. And it's like, well, what are they like, what else are they doing other than like creating services to help people in the country that they govern over? That's maybe for another vlog, but it's just, if you really think about it, the situation is just completely untenable, and it's a complete paradox. It's just, it doesn't work, and it just should be fixed, because there are solutions to this. Like, get people healthcare, like Medicare for all, Medicaid for all. I forget which is the one or whatever, but basically at the end of the day, there should be a baseline level of healthcare available to everyone in the country as a part of living in this country and being a citizen. Because truly, like, I'll get into it later, it actually is a national security problem. Okay, so let me part two this, because we're at past the 10-minute mark, and you know, I like to be safe. I don't want to lose this. I think that's pretty good. All right, we're back. All right, so what else? Oh, the economic implications of untreated mental illness. Oh my God, all of these implications. So there's productivity loss. Has been documented in studies. Untreated mental illness caused the United States economy approximately $282 billion annually, and that is comparable to the impact of a major recession, and that's annually. So if we just proactively made sure that people with disabilities and serious mental illness weren't just like floundering, then it would actually save $282 billion a year. And I guarantee the cost of that the proactive services is not $282 billion. I'll follow up maybe another vlog with that. But I've already also done the math about supportive and transitional housing, and that math actually works out that the proactive service of transitional and supportive housing is cheaper than the cost of untreated mental illness and homelessness. Workplace absenteeism. Employees with poor mental health report nearly 12 days of unplanned absences annually, compared to 2.5 days for their healthier counterparts, leading to an estimated $47.6 billion loss in productivity for employers. That seems like a problem that, you know, could be solved. So why not, let's make an economic argument. Why not save all of these companies, what, $47.6 billion? Okay, if we're gonna give all of our money to CEOs, then, you know, maybe they want $47.6 billion more money. Truly though, that's really interesting, because people who are not functioning optimally in their employment, especially if they're in a job that doesn't have healthcare benefits, they're just not going to be operating as optimal as the company wants them to be. So if, let's say you have like even like not schizophrenia, but like depression, which is still like a mental illness. Let's say you have severe depression. The thing about that is you're gonna have unplanned days of absence. But if that was like able to be treated in a way that like the government could like pay for that treatment, and the companies, you know, I don't know how, you know, I'm not making an economic plan right now, but I'm just saying that if it was able to be treated, then those days of absenteeism wouldn't even occur, so that lost revenue wouldn't happen. I don't know. It's just like when you think about it in this kind of like context, it's just like, why don't we give everyone healthcare? It's truly insane. It's truly crazy. And I hate the word crazy. I hate misapplying the word crazy, but this truly is crazy. What else? Cost of inaction versus proactive care. Okay, so we already got it. Investing in mental health programs can yield significant returns. For instance, companies have seen net benefits of $125,000 by investing $50,000 in mental health initiatives, highlighting the economic advantage of proactive care. So this specifically means that employers who invest in proactive mental health services see a return on that investment, which just means that it's worth the investment. So that investment can be like giving employees access to gyms, subsidizing like a gym membership. It could be like days off. It could be like having quiet spaces in an office. It could be any of those things. But according to the data, it means that there is actually a return on that investment. It's not just like feel-good stuff. It actually makes the employees feel better, which makes them work harder and better. It's so funny. Just like, it's really so funny because truly, it's such an easy argument. Like when people feel good, they act better. So it's like, why not create services and why not give people healthcare so that people can act better and be healthy? Like, I don't get why, like, why not? Like, I mean, we've tried almost everything else in the world, like in America, we just like constantly like, why not try something new? I don't think we've tried universal healthcare before. I don't think we've tried healthcare for all before. Like, why not try it? Like, let's do a trial run. Like, why not? Here's this one, like really, like it just like, it gets to me so much because the assumption that everyone has a family member that has the capacity to be their caregiver, it's just such a horrible assumption because it's just like, it's like not really the case at all. Like that burden should not be placed on anyone. And I'm using the word burden because it actually is a burden. I know that it's like, it's not nice to think of like, those aren't like, that's like not a nice word or whatever, because it's just like, no one's a burden, but like it is actually a burden. Like it is like a workload that is placed onto someone and they didn't necessarily ask for that workload. So it's just like, why do we do that? So here we go. Prevalence of unpaid caregiving. Oh my God. Approximately 45 million Americans provide unpaid care, with over 11 million caring for individuals with Alzheimer's or dementia. Okay. So 45 million Americans provide unpaid care. So that could be for the elderly, it could be people with disabilities, it could be people with serious mental illness, which is a disability, but it could also just be, it could also just be like elderly care. That is 45 million Americans who are not getting, did I say 45 million? 45 million Americans who are not getting paid for a service they are doing. They are completing that service for the government, essentially. Like, yes, out of love, but also that is like a service that the government should be doing. So that is unpaid work. 45 million Americans, unpaid work, and 11 million of those are caring for Alzheimer's or dementia. Like, that's a really hard job, especially if you have another job. and you also have to go home and you have to like do the dishes and you have to like do laundry and all these things. It's just like, oh my God. And then you actually have to like care for someone who like literally needs that care, otherwise they're just gonna die. Like, what the hell? Like, sorry if I'm allowed to swear. What the hell? Like, truly, that is insane, because it is possible to reorganize things. Like, it's unacceptable at this point to just be like, well, we can't reorganize things because, like, you know, we just like can't do that. It's like, well, why? I'm pretty sure we could find some room in the budget to change some things. I mean, like, I'm not, again, talking about an economic argument right now. I'm not like making an economic plan, but it's possible. It's possible. All right, what else we got? Oh my God. Economic value. The annual value, all right, this is actually interesting. All right, it's all interesting, but this is really interesting. The annual value of unpaid caregiving is estimated at $873.5 billion, underscoring the substantial economic contribution of family caregivers. So $873.5 billion is currently like the amount of like money that family members are currently giving to their family members to give care for people with disabilities or the elderly. That's almost $1 trillion that is just like, oh, well, we're just gonna assume that you're gonna do this work. We're just gonna assume that, like, you know, it's, please actually just do it. You kind of have no choice, but it's insane. So here's the other thing, the mental health impact on those actual caregivers. Nearly half of caregivers report that their mental health has suffered due to caregiving responsibilities, experiencing higher rates of anxiety, depression, and substance abuse compared to non-caregivers. So that makes complete sense. If you're a caregiver and you're caring for someone, let's say like your elderly, like, father or whatever, like, you may not have the coping mechanisms to deal with that because you're not going to be likely like a trained professional to do that. So you may fall into the pitfalls that just like regular humans do. Like, you may start drinking, like you may smoke weed, like anything. Like, you can do like anything, any vice that you just may do that to like escape or whatever, because like that's just like what happens. So it's like, that's horrible, because so there's almost $1 trillion of unpaid work, and then that's just like placed onto people, and then we're just also assuming that they're just going to be like, yep, I'm going to do this, yep, and I'm not going to have any sort of like feelings about it or reactions about it. And then that's just not the case, because that's not like living in reality to assume that people aren't going to like be affected by having this burden placed on them. Part 3. Oh my God. Okay, so here's the other thing. Workforce shortages. Over 150 million Americans live in areas with a shortage of mental health professionals. So that just makes it harder. So that's just like a additional barrier to get people treatment, but it's also something that can be invested in to get people that treatment. Delayed treatment. The average delay between the onset of mental illness and treatment is 11 years. That highlights systemic barriers to timely care. So that means that on average, when people's mental illness starts to manifest, it takes them 11 years to actually get treatment. That's because of stigma, the lack of access to care, any of these things. But that just means that that's a window that we could really start to make shorter by investing in proactive services and also reducing stigma around mental health care. The criminal justice intersection. About 2 million times each year, individuals with serious mental illness are booked into jails, indicating a failure of the healthcare system to provide adequate support. So this is a really like horrible one, because not only are people, let's say, schizophrenia is a really good one. I mean, it's a really good example for this. let's say people who don't have that caregiver, were never able to get that job, and just like went through life with schizophrenia untreated because they don't have insurance and can't get insurance. Where do they go? They eventually will have to likely like sleep outside, like not have a home, and just like continue to have that condition worsen, because those aren't ideal conditions. Like, that's not a therapeutic setting to like have to essentially fend for yourself every single day out on the street. That is an unacceptable circumstance that almost 1 in 20 US adults could end up in. And then that's also an economic burden onto the criminal justice system, because those are people who should be treated for their mental illness and not treated like criminals. So it's just completely unacceptable, and it's completely dangerous, because it could also end up like turning into situations where someone could die. Like, it's just truly, that's what happens. Like, that's the pattern, and it's something that it should not happen. Because the problem is not people with mental illness. The problem is a system that is designed almost to punish them just for existing, when we could treat them and life will be easier. So there's a bunch of other stuff, call to action, but something that I really want to talk about. Okay, so I mean, policy reform, simplify disability claims, support caregivers, invest in mental health infrastructure. So those are all things that we could do to make it so that these problems don't happen anymore. But at the end of the day, it really just boils down to healthcare for all. Everyone should have a minimum access to healthcare, like a minimum amount of healthcare. Healthcare for all doesn't mean that everyone gets free plastic surgery, like free elective surgery, like all of these things or whatever. But it does mean that there should be a base level access to care. Like, if you end up in the hospital, that's not getting elective surgery. So I don't really understand why there's so much pushback when it comes to healthcare for all, because it really, like, on the margins of society, it just makes so much sense that it is better to invest in healthcare than to have the economic externalities of not investing in that healthcare. Because the economic externalities, they reverberate throughout the entire system, the criminal justice system, the workforce, just like the pleasantness of a neighborhood. Like, there's all these different things that are affected when people don't receive the care that they need. Something else that I really want to talk about is the national security implications of all of this. This, I think, is actually extremely under talked about, because people are talking about healthcare for all, but I don't really hear about what happened. Like, there's an argument to be made that if you're one of these people that doesn't have access to healthcare, doesn't have a caregiver, doesn't have disability benefits, like any of these things, and you're just living on the street, and you're going to be really mad at the system. And that's at almost the most marginal of society. Even if you are employed but don't have healthcare, you're still going to be mad at the system because you're going to want healthcare. It's not, oh my God, these birds. Wait, excuse me? I'm sorry. No. I'm sorry. I'm actually vlogging right now. So, oh my God. All right. Wow. These birds. So, you're just going to be really mad at the system. And because of that, you're able to be exploited by any kind of amount of you could be exploited by anti-state agents, you could be exploited by foreign national governments, authoritarian foreign national governments that don't like the United States. You could be exploited by like criminal networks, you could be exploited by like really any of these things. And the thing about that is like that anger that people feel towards the system, it's anger that doesn't need to happen. Like it just like it doesn't like no like we can fix this so that like we don't have this population of angry people in the United States who are just like, well, I don't care if it all burns down. I don't care what happens because the system isn't looking out for me, so I'm not going to look out for it. When we could just redesign the system a little bit and make it so that like people are more taken care of and like that anger can start to dissipate. Whereas like right now, I can in like less than a minute tell you exactly how like someone could essentially create an information campaign to radicalize a population within the United States to get them to essentially want the United States to fall because of the fact that they don't have healthcare. Like that's a really easy thing to do now that like the internet exists and like digital advertising tools exist. It's just extremely possible. And I'm actually not going to say exactly how to do it right now because it's just like anyone is able to do it. And it's just really possible. So just like to think about it, like truly, if you are someone who does not have healthcare, has schizophrenia, is untreated, you're going to have really disorganized thinking and you're going to be really susceptible to things like conspiracy theories and like just like radical propaganda and all that kind of stuff. And that just doesn't need to be the case. Like we shouldn't be allowing vulnerable people to be exploited just because they're disabled. Like that's truly what's happening right now. And it's just so unacceptable. It's just unacceptable. I'm sorry. Like, how else can I describe it? It's unacceptable. I don't know. I'll keep on writing. I'll maybe post something here, but like, that's just like what I keep on thinking about right now. And it's just like really, it's just really intense and it's really real time right now. And I think just really not the single answer, but one of the steps to get the system to be more compassionate and like self-sustaining is really to get healthcare for all. So just to recap, oh my God, should I part 4? Oh my God. Okay, just to recap, wow. There's a paradox in the American healthcare system because it is assumed that disabled people have the wherewithal or a caregiver to get disability insurance from the government or to find a job that will give them healthcare benefits. And one, it's actually really hard to get disability benefits from the government. And two, it's actually not that easy to get a job with healthcare. It's like that's not super easy because actually a lot of jobs in the United States are becoming contract, and then also just healthcare benefits aren't the norm for a lot of like entry-level positions and all like things like that. So because of that, there's a population in the United States that suffers from disability or severe mental illness, which is a disability, but like there's a disabled population in the United States that has no chance almost to make themselves better based on how the system is designed, and it's not their fault at all. It's not their fault, but they're being punished for it, and it's unacceptable, and it's just completely unacceptable, and something has to change. So that paradox, it is bad because it has economic implications where it hurts the workforce, there's lost productivity, it hurts society because there's economic externalities in terms of the criminal justice system and just like populations and just like neighborhoods that have higher numbers of like homeless people inside of it, like that's just like not a great thing for that neighborhood when those people should have housing and it'll all be fine. There's caregivers who don't make money, like who are like being like the work is being put upon them when they should be compensated for that work. Even if they love the person that they're taking care of, it's still hard work. And then what else? Yeah, the national security implications. It's just like even just the national security implications is a reason to get everyone healthcare, because it's like we should not have a population of potentially millions of people within the country who are like this angry at the country and just like want America to fall, because that's kind of where things are trending right now. And it just like doesn't have to be the case if some people who are in power just like kind of like realize that, and we're just like, wait, actually healthcare, it's a really big priority. So yeah, that's what I've got. I think this was a really productive vlog, actually. I think this was really good. I'll dive in, I'll double click more, but like as a top level argument, I think I hit all the points that I wanted to get to. And yeah, like healthcare for all. I mean, like truly, like if you don't think that everyone should have healthcare, I just don't understand. Please reply down in the comments why people shouldn't have healthcare. And if you say a good argument, I may reply. And if it's not a good argument, I'm not gonna reply. But like, I just don't get it. I truly don't. I truly do not get it. And this is as someone who, like at a different time in my life, I didn't think that there should be universal healthcare, and I did not think that there should be healthcare for all, because I bought like the political propaganda, I bought the narrative that like if we were to do that, then like the standard of care would like lessen and all that kind of stuff. But like that, I don't even think that's an accurate argument. And maybe I shouldn't even brought that up. Oh my god. But like, you know, just keeping it real, I've changed my mind, and I feel adamantly about this, and I think that my arguments are almost like completely diamond. They're very, very strong. So now I guess I'm just like kind of searching for an outro. That's all I got. It's a beautiful day. Healthcare for all. Everyone should have healthcare. I don't know. I think that'd be right. All right. That's all I got. Healthcare for all.